The purpose of this analysis is to identify a potential association between homicides, drug overdose deaths, motor vehicle accident deaths, and alcohol-impaired driving deaths based on poverty rates for each county and state. For the data visualization, it is recommended that we enter full screen mode by clicking the icon in the lower right corner. The two geographical maps in our dashboard display the number of deaths under age 75 from the National Center for Health Statistics. The data in these graphs are aggregated at the state and county level. Hovering over the state map will display a sentence interpreting the findings at the state level. Hovering over the county map will display a sentence interpreting the findings at the county level. The scatter plots at the bottom of the dashboard display the relationship between the percentage of children under 18 living in poverty. Poverty status is defined by family. Either everyone in the family is in poverty or no one in the family is in poverty. Measure of homicides per 100,000 is an estimate of the number of deaths due to homicide per 100,000 population from CDC Wonder mortality data from 2012 through 2018. Drug overdose deaths per 100,000 is the number of deaths due to drug poisoning per 100,000 population from CDC Wonder mortality data from 2016 through 2018. The motor vehicle accident deaths per 100,000 are the number of deaths due to traffic accidents involving a motor vehicle per 100,000 population from CDC Wonder mortality data from 2012 through 2018. Alcohol-impaired driving deaths is the percentage of motor vehicle crash deaths with alcohol involvement from the Fatality Analysis Reporting System from 2014 through 2018. Now let's say we are interested in evaluating whether there exist relationships between poverty and premature deaths in Oklahoma. Using this dashboard, we can filter data to a selected state. As shown, you can see that Oklahoma has an average of 10,345 deaths per 100,000. The relationship with child poverty rates is highest with the number of homicides and number of drug overdose deaths per 100,000. By hovering over any of the dots, we see the county level measure of the variables on the X and Y axis. If we hover over the highest point of drug overdose deaths, we see that in Adair County, Oklahoma, the state's level of child poverty is the highest, as well as the state's level of drug overdose deaths in the county. Hovering over the trend line for each plot, we see that there is significant relationship between child poverty and homicide, drug overdose, motor vehicle accidents, Meanwhile, we see a strong positive trend with child poverty and alcohol-impaired driving deaths. But the relationship is not considered significant, as the p-value is greater than our alpha of 0.05. The use of this dashboard can reveal trends in the relationship of poverty, premature death rates, and other outcomes that may reveal geographic differences. Any observed differences between states may be understood by demographic and socioeconomic differences.